All right, everyone, welcome to the next part here, which is part 3 of our bonus module of fixing ER workflow issues. Our goal here will be a very important one. It is fixing prolonged lab and imaging orders. Now, this is another frequent issue that I see that delays people's workflow, thereby delaying their note time, thereby delaying the time that they get off work and their overall happiness or ability to continue working and longevity in the ER. Here's what we'll cover here. The first one is creating order sets. This is going to be critically important. You cannot be ordering labs individually, all right? Ordering labs before seeing a patient. This is also important. I know that some people like to see the patient first, and we're going to talk about the pros and cons of that. Number 3 is going to be ordering initial labs or add-on labs in the patient room if possible. This is just another way to increase our time efficiency in the ER. And the fourth one is a very important one. It is creating a quick access folder for labs and imaging. This is going to be a very important module. I think it will have utility for pretty much everyone in improving their workflow. All right, so let's go into creating order sets here. First off, what are order sets? Order sets are saved groups of orders for specific chief complaints. And these are critically important for your speed. So basically, in whatever EMR system you use, there will usually be a way for you to save into a specific folder, for example, a chest pain workup. And that might include a CBC, a BMP, and a troponin, a chest x-ray, and an EKG. And maybe even a repeat troponin. Now, you do not want to go into every chest pain patient and order a separate CBC, a separate BMP, a separate troponin, because every time you do that, you are wasting valuable seconds that you could be utilizing to see the patient and write your note and basically overall just improve your workflow. If you're not creating order sets, it's going to massively delay you, even though it might not feel like it in the moment because you think I'm just spending just a few seconds ordering these labs, but it truly does add up. So that's why, again, I really stress that this is critically important. If you already know how to create order sets, great. If not, we'll actually go through it, but this is critically important. The next thing is unless you have order sets that are actually fully sufficient, I would like you to make your own. And the reason is because once you have your own order sets, you know what those order sets contain. You're not having to do a lot of adjustments. But what I often find is that if you're just using order sets provided to you by your EMR, then you're going in and you're making changes too often. So for example, it might have a troponin at 3 hours, and you're always going back in and changing it to 2 hours. Well, that takes a lot of time. And it is best to actually just save your own with your follow-up troponin time the way you would like it to, and have it pre-made and preset for all your chest pain patients. We can go through some examples of this as well. The next thing I really want to go through here is ordering labs before seeing a patient. Now, I understand that sometimes you see a patient and pop up on the board and they're chest pain, and you think, you know what, I just want to go see that patient first. What I find is that you can actually, and I do the same thing, but what I find is that you can actually utilize certain criteria for patients to just put in labs before seeing a patient, and I urge you to attempt to do this. For example, if you see a 60-year-old chest pain patient, you know you're going to be ordering labs on that patient, I would say just go ahead and do them because it gets things started and in flow. So it allows nurses and other staff to begin their processes. It'll help your workflow immensely, especially if you get occupied with another task. You want things processing. Even if you didn't fully need that CBC on that chest pain patient who was 28 years old. However, now you have it because you got caught up in a trauma and you had ordered it before seeing that patient who you know was stable and did not need your current attention. Now when you go back to your desk and the patient says anything that could be something like, I have had anemia, well, now you have your CBC, it's ready, you know the hemoglobin is normal, and you can discharge that patient. without having to start things from the beginning again. This will also massively help workflow and will just get things moving faster. And again, just to reiterate, usually for things like abdominal pain, chest pain, dyspnea, you have a standard set of labs and you will be ordering those things, certain labs. So you'll eventually, as your practice continues, notice very little variation in what you're ordering for some of these patients. Minor tweaks here and there, but it does help to get those things started, and definitely a big workflow issue. I've got some standard orders for many chief complaints, and I'm actually going to just include them in a sheet here so that everybody can access it. You probably have your own orders, but this is just something to help you along the way if you feel needed. Here's the strategy. Place these orders in your own folders and add and subtract as you see fit clinically. Basically, my orders, I will use them. I have order sets that I utilize for certain demographics of patients, like a young female or an older female or a older male, and those are for chest pain, abdominal pain, etc. All right, so we'll continue on here. The next thing is ordering initial labs or add-on labs in the patient room. This, for example, if you are seeing a new patient comes in by EMS and there's a computer in the room, I urge you to just start ordering labs from your order set while the patient is in the room. Things we're not realizing is that the nurses are setting up patients on EKG leads. EMS is transferring them to the bed, and a lot of the time we're just standing there watching this happen as we wait for a story or as we wait for people to free up, or even bed space, because sometimes the nursing staff will be surrounding the bed. In that time, if you're able to log into a computer in the room and even just get the orders pulled up, you're likely going to have heard a chief complaint, like if this patient is coming in for abdominal pain, and you just throw in your order set and have that out of the way. Additionally, you could use the same strategy for add-on labs. So if you are pre-ordered labs for a patient as per our prior slide, and you are now in the patient's room and the patient says, you know what, I have been having chest pain, but I also was on a very long flight and they're a bit tachycardic. While you're in the room speaking with them, you already know you're going to do it. Throw in that CTA chest if you feel that is necessary, instead of waiting to go back to your computer or instead of holding it in your mind. Again, we're going to go through something big in this course, which is freeing up your mental space and mental reserve, and that's part of it right there. So if you must go to your computer to order one lab, I would say try as much as possible to multitask the lab order. Of course, this isn't always possible, but try. So for example, if you go back to order a CTA chest on a patient who you had just put in some basic chest pain orders on, well, just look quickly through and see if there's another patient you can print discharge paperwork for, or if a lab is back for a patient that'll make you make a critical decision in terms of the next step. Maybe you were waiting on a D-dimer for another CTA. Maybe you were waiting on a X-ray so that you can ask techs to put in a splint for somebody. So just multitasking that is actually very helpful for workflow as well. All right, last thing here that I will discuss in terms of labs and imaging orders is something very important, and I'm going to show you my example as well. And this is, the truth is you will frequently need to order labs and imaging which you did not anticipate. Whether that's a CT brain for a headache that you didn't really think was going to need one, a CTA chest, abdomen, pelvis looking for a dissection, or whatever it may be. These are just things that are not super standard that you have to add on. And I would urge you to create a folder in your EMR, and I call mine Quick Access. That's my Quick Access folder. It basically has all labs which I order in a standard fashion. And I will show you an example of my Quick Access folder and what it contains in it. It basically contains everything I would order in general. So if I have a CT brain, it is in my Quick Access folder, but it's not just CT brain. I have it for trauma, I have it for altered mental status, and the reason is because I do not want to be pre-typing the reason every single time. I just want to quickly access it. I don't want to touch my keyboard, and I just want it to be ordered. So I will actually go through that. I think it'll be helpful to see, and it will also help with your workflow. Awesome. So for now, this concludes our part 3 of our workflow efficiency module, and we'll continue moving on to the next part.